Hello everyone, welcome to Sakkare Guru. Today I'll be talking about device-related skin problems, causes, and its prevention. CGMS and insulin pump related skin infections are common skin problems that may result from CGM patch. One of the most common skin problem is visible tissue abnormalities, and one of them is scarring. Scarring often occurs from the frequent insertion of the CGM device over the skin. Scars can inevitably make it harder to insert the CGM, as well as affect insulin absorption through cannula and compromise accurate glucose measurements. So how do you prevent it? Areas with heavy scarring should be avoided when inserting a CGM. Keep rotating the insertion site. Give 1 week gap to come back to the same site again. The next tissue abnormality is tearing. Tearing of the skin can be caused by adhesive materials which are found in CGM devices or while stripping them off. This can cause damage to skin and underlying tissues and can lead to redness, bleeding, bruising, and even liquid discharge. These can be prevented by gentle handling of the device and to avoid using harsh adhesives. Soak the patch with an adhesive remover like coconut oil or olive oil to remove the patch easily. This tearing can be treated by emollient creams like Moisin, Cetaphil Dam, Olent, Elosoft, and many more. The next skin problem is allergic reactions, which can be seen as burning, itching, or stinging on skin. Hypersensitivity can occur due to contact with some allergens. CGM devices have an adhesive substance used to keep the device attached to the skin. Allergen contact can lead to hives, eczema, and reddening of the skin. It can be prevented by using hypoallergic adhesive patch. Use Tegaderm on skin and then put sensor on top by making a hole in the center of Tegaderm. Application of skin barrier spray like Cavilon or nasal steroid to the skin. So put 2 puffs of it, let it dry completely, and then put the patch. Mild to moderate allergies can usually be treated with antihistamine or anti-inflammatory creams and topical ointments. So these are some of the products that are available in the market that can be used to treat scarring and tearing. So what to do? Clean technique, good hygiene, and changing the site as recommended are the best protection against skin infections. Careful attention to site preparation, insertion, site rotation, and daily checks of the site will prevent most infections. However, serious consequences can occur if insertion site irritation is ignored. Few suggestions for avoiding skin infections at insertion sites. Assess the skin, avoid broken area, unhealed irritation, and close proximity to another infusion set or sensor. Always wash hands thoroughly with soap and water prior to removing used infusion set and also before preparing a new set. Previous insertion sites should be given a minimum of 1 week to heal before new tape or adhesive agents are placed over sites. Change the infusion set every 2 to 3 days, preferably after a bath or shower. Prepare the new infusion set on a clean surface such as clean paper towel. Always remove an infusion set at the first sign of abnormal discomfort at the insertion site and place a new infusion set in a fresh site away from the original area. If any of the infection signs given below are present, one has to call the doctor to seek medical help. If there is redness around the skin or site, oozing from the cannula site, area warm to touch, tenderness or soreness around the site, or unexpected high blood glucose levels. One more topic that I'll be talking about is dislodging of the patch. Few things to be considered before inserting the patch so there is no dislodgement of the patch. Remove any adhesive residue from previous sensors. Consider using an adhesive remover such as Unisolve, Detacol, Tackaway, or coconut oil. Clean and dry the sensor site twice. First, wash with soap and water, let it dry, then scrub the site thoroughly with an alcohol wipe and let it dry again. Shave the area before putting the sensor. Immediately after sensor insertion, rub around the entire patch 3 times. For extra pressure, consider using back of your nail. Smoothen out if there are any wrinkles in the patch. Use the overpatch or medical tape to keep the patch on your skin. If your skin has higher moisture content, consider putting on an overpatch or medical tape immediately after inserting the sensor. Micropore plaster, Dynaplast, Hania, Anzai-Lala transparent stretch adhesive bandage, or fixable stretch adhesive tapes. These can be used to keep the patch in place, and these are easily available on Amazon. Applying a solid or spray unscented antiperspirant prior to inserting can help with skin prone to sweating. Apply a thin layer, wait for 10 to 15 minutes, wipe off excess product, and allow it to dry completely before insertion. Thank you.